It is my great honor to welcome not only a brilliant scientist and global health leader, but also a dear friend, Dr. Navid Madani. Dr. Navid is a senior scientist at Dana-Farber Cancer Institute, the faculty at Harvard Medical School, and the founder of the She Center, a visionary initiative that empowers women and builds research capacity across the Middle East and North Africa. Through her groundbreaking work in HIV and her tireless advocacy for equity, she has become a voice of hope and dignity in global health. But what makes Dr. Navid's story even more extraordinary is her personal journey. In 2019, she was diagnosed with stage 4 ovarian cancer, a life-changing moment that could have silenced her. Instead, she turned it into a source of strength. Even while enduring multiple surgeries and clinical trials, she has continued to mentor, to build, and to inspire. Her dual perspective as both scientist and patient gives her an authenticity and compassion that few can match. And I must add, if you are fortunate enough to have Dr. Navid as your mentor, think long term. She will stay in your life. She will not only guide you in science and leadership, she will become your friend, your mother, and your fiercest champion. She will hold your hand and she will push you forward, and she will empower you to rise stronger than you ever believed possible. On a personal note, Dr. Navid and I bonded over our shared Middle Eastern heritage, often over a cup of tea, which is why I love the title of her Tea Time with She podcast. But our true bond was forged mainly because of her humanity, her generosity of spirit, and her extraordinary ability to connect beyond titles and borders. Today, I am so grateful to share not only her achievements, but also her courage, resilience, and friendship. Please join me in welcoming Dr. Navid Madani. Dr. Navid, my introduction to you was through your mentorship and capacity building work in research in the MENA region, as well as through your cancer advocacy. To be quite honest, until this podcast, I am ashamed to say I did not know in depth about your internationally recognized pioneering work in HIV research, particularly on CD4 mimetic compounds. Can you tell us how you first became interested in this field and explain to us in layman terms about these CD4 mimetic compounds? How do they work and what is their potential, especially for women?
Well, thank you, Johannes, Princess Dina. Thank you so much for this lovely introduction. I don't deserve it. Thank you. I'm really humbled and honored. And I'm honored to be here on your podcast. And inshallah, we'll host you at Tea Time with She next week on Tuesday. My journey in the research arena was really interesting. I came from Iran. I was very tunnel vision that I wanted to study medicine. But in my university in California, in order to graduate, I had to do independent research, meaning that I had to come up with a thesis-driven question in basic sciences in the area of chemistry and biochemistry, which was my major. So the world of research got opened up for me. Like as a Middle Easterner, especially in late 1980s, early 1990s, growing up in Iran, I had no idea what research was. We hadn't done anything like that, in high school, where right now in US they do that. So I got introduced to research, and then it was like a puzzle. you put one puzzle piece in there and then another door opens for you and there's more puzzles to do. So that was very exciting for me. I was a huge Los Angeles Lakers basketball fan. And when Magic Johnson was diagnosed with being HIV positive, that really affected me. I was a huge fan. But it's interesting. A lot of people, because of that, a lot of people think that's why I went into the HIV research, but it wasn't. It actually was because of viruses. It was amazing that these small beings would take control of our body with such amazing change of machinery. Like they would take advantage of our cells and start building their own machinery within our cells. I have to give a lot of credit to my mentors. I've been very lucky to have wonderful mentors, and it just happened that, for graduate work, I went into a lab that was studying viruses. It was in mid-1990s. HIV I'd been identified about 10 years. So we didn't know much about it. And my advisor came to me, one of the brilliant minds in the virology field, and said, Navid, I want to do something extraordinary and it's high risk. Would you be up for it? And I said, yes. So we looked at how virus, because up till, AZT, the compound, the drug that is still being used, is used after this virus enters the cells, after the virus, goes into the cell. So we wanted to look at how virus enters the cell, so that we thought the more we knew about entry process, the better we could inhibit it. And the other part of it that boded well for us was that all the players that are involved in the entry process. Just imagine the door in your room, in your house, that's outside, and then you don't want people to come in. So in the outside, it's easier to try to inhibit them to come in than after they come in, because after they come in, they're going to have access to your stuff. Right? So we wanted to stop. We wanted to know as much as we could about how the virus enters the cell. And then based on that knowledge, we wanted to see how we can inhibit it. So I spent decades, pretty much from mid to late 1990s until 2000, until now actually, but my HIV research, because of my illness that you referred to, has come down a little bit.
This is huge. So what do these CD4 mimetic compounds do? Do they stop entry? What do they do exactly?
Yeah. It's fascinating. I get very much excited, and when I talk about CD4 mimetics, in 2005, New York Blood Bank did a screening of a lot of compounds for stopping HIV, and my colleague and I looked at a paper that talked about specifically two compounds. I don't want to call them drugs, because drugs are when they come into the market. I'm going to call them compounds, but it's like drugs. So they talked about two compounds, and we, my colleague at Hopkins said, Navid, let's look at this. Let's make him and look at it. We looked at it in a small tissue culture, like basic science tissue culture. And one thing that we noticed that was these compounds enhanced entry. It allowed the virus to enter the cells rather than inhibit, without the work of HIV receptor, the protein that HIV needs in order to enter the cells. So two things went into our mind. One was, wait a minute, we don't want enhancer, we want inhibitor, right? The second thing was, if these compounds are enhancing, that means they're binding to an area of HIV that is very important for entry. That was kind of our lottery thinking ticket. So with collaborations with chemists at UPenn, Hopkins, Drexel, Columbia. So it was we were the virologists and the biochemists. So we had a cohort of collaborations in 20 years, pretty much. We took these compounds that were enhancers into inhibitors. So what do we have right now? We have compounds that look kind of different from the compound from 20 years ago. We've changed it, but we know it binds to a very unique area of HIV, and we are testing them in a vaginal ring. So 99% of women around the world don't have a say. They can't control, usage of condoms and many prophylactic, modalities for, viral transmission. So we are, with collaboration with our colleagues, we have a vaginal ring. We have put these compounds into this ring, and we are testing them in female monkeys to see how these compounds get out of the ring, how long do they stay in the vaginal tract, and how well they can inhibit HIV transmission in female monkeys. So that study is being done right now, and it's, like I said, 20 years of work.
Well, I hope we will start to see it applied, soon. I don't think we can wait 20 years again. My goodness, you scientists have a lot of patience. No wonder I always see you calm and collected, compared to me, certainly. 20 years to wait for results. That's unbelievable. You've said something that struck me, Dr. Navid. I saw it somewhere, one of your quotes. Science is not neutral. Who it serves depends on the questions we choose to ask. It's so correct. And that is why there's so much, so many diseases that are not researched, I suppose, and why research is so important. And why it is important to disseminate the science of research all over the world, so everybody can ask the questions that they need to ask for their populations. Can you tell me more about that?
So that's, that is actually the reason I initiated the She Center. So I was, I think, I always ask my husband this, I was very shy. I would go to conferences, give my talk, present my poster. I never would go to like happy hour, talking to people. I would go back to my hotel room and, read or work on my computer. That's it. So, my science really took me to the region of my birth, Middle East and North Africa, because I was, blessed enough to publish in very good journals. And because of my last name being Middle Eastern, I think different, universities would see, good papers and they would invite me. And then when I would go there, a lot of young people would come to me, ask a lot of questions, and they ask about, reproductive health. They ask about basic science research, how they can do research, how they could be mentored, and during these trips, I really saw a gap that we don't have data on people that look like us. We don't have research data coming out of our region. And that is pretty much the fundamental reason that, I kept going back. I kept teaching. And I did everything kind of, just like scientists do. They have a question, they want to answer it, and we do everything under the radar. We don't advertise it, especially back then without social media. Now you publish something, you put it on social media. We didn't do that. We did everything kind of under the radar. And then I really owe the She Center to our former chief scientific officer, Dr. Barrett Rollins, because he found out about the She Center and the kind of work that I'm doing. And he said, Navid, this is very interesting. So when I look back for at least a couple of reasons, I really have a lot of gratitude to our former chief scientific officer at Dana-Farber, our CSO, because he critically looked at what I was doing. He was his MD PhD, very data driven, and he said, Navid, this is really good. You need to make a center out of it. Put together a business plan, write down what you want to do in the next 5 years, and we'll present it to the leadership and to the president of Dana-Farber, and then we'll see what happens, and that's what I did. I put together a business plan for the She Center. I talked about everything that was like close to my heart. This is what I want to do for the Middle East. We don't have data from that region. We don't have cooperation from that region. And this is what I want to do. It's a gap that Dana-Farber can fill really well, and we can teach our people. And you and I can talk about the She Center a little bit more. But and I brought in people that had known me and had known the work that I was doing before the She Center became a center, because all the work that I've been doing, I was doing before. And one of them was Tony Fauci, the father of response to infectious diseases in the United States. Another one was Professor Eric Goosby, who is the UN under President Obama, the UN ambassador to decrease TB, HIV, and malaria. So all these people I had brought in, and I had kind of every time I talked about the kind of work that I wanted to do in Middle East and North Africa, I would, have a think tank session with them. I would throw ideas at them, and I would, they were obviously much senior than me, and they'd seen much more, and they've been in, I had never been in global health that they had been in for many, many years. So it was really good. And that was the kind of transition that I added the work on global health and She Center next to my HIV work.
Well, it's great that you explained the impetus of how you started the She Center, and it's a powerful impetus. And I just want to say that when you started, I think you got the plan. You told me to go ahead with the department in November 2018, but in 2019, which was a very pivotal year for you, while you were busy planning to establish the department, in May of 2019, you were struck with stage 4 ovarian cancer. Now, I have to say, Dr. Navid, many in a similar situation would have put a hold on such a plan. But you did not. You actually went ahead. And I know that this says a lot about who you are, Dr. Navid. So you continued with your vision. Tell me, how did it evolve? We'll talk about your personal journey a bit later, but how has it evolved since 2019.
Yeah.
And where is it? Where is it now? And tell me about the programs.
Right.
How do you implement your programs? How are they structured? And how are they unique? Many people do capacity building and so on. But from talking to so many colleagues at the King Hussein Cancer Center who have attended your sessions, they just, raving about the courses. So there is something there, something unique. Please tell us more about that.
Thank you. You're right. In fall, winter of 2018, um, Barrett, our CSO, and I went to our president's office. And by that time, I had gotten approval from an outside advisory committee that Lori, our president, Dr. Lori Glimsher, at the time, our president, knew all the outside advisory committee. I gave her a 25-minute presentation. She asked me a lot of questions, and on the spot, she said, "Navid, this is really good. We need to do this." Now, mind you, Dr. Glimsher, it was very much is a wonderful immunologist, but she really believed in global health. She used to be the dean of Cornell Medical School, and she was the one that initiated Cornell in Doha, Qatar, during her tenure. So she was familiar with Middle East and North Africa, and she wanted, Dana-Farber to have a presence in the region as well. So that was about October, November of 2018. And then we go into 2019. I was on top of my game. I had just, a year before, I had received an NIH grant, National Institute of Health grant, R01, to work on my CD4 mimetic. I had a wonderful postdoc. I had a great technician to help me. And then we were putting together philanthropy help to get funding for the She Center. And like you said, in May of 2019, I'm diagnosed with stage 4 ovarian cancer. I don't know. It's so interesting. I thought of two things, like immediately when my doctor called and said and I didn't have any symptoms. I felt like I was healthy. Two things that worried me. Two things that really helped me. One was, I'm not a glass half full person. I'm glass water spilling all over the place.
Clearly.
So I was shooken up. I was like, oh my God, I hang up. I was in my office. I hung up the phone and I'm like, what's going on? Oh my God, what am I going to do? And then it's like the other Navid came on and said, calm down, just think about it. And two things came to my mind at the time. One was, you're at Dana-Farber. You're at best place possible. So don't lose hope. People, this is your home, And two was, thank God that it's not your kids, it's you going through this. So those two thinking made me kind of get up, walk, I had a big surgery so this was May 9th when they called me, and then May 24th I had a big surgery. And then I remember June 11th or June 10th was of 2019 was my first chemo session. And after the surgery, they couldn't take out the tumor because they said the tumor was very large. We have to do chemo and then do another surgery. So I had another big surgery that was done in August 28th of 2019. I don't know. I think part of it, as Middle Easterners, we go through so much, life is so uncertain for us that we we keep on thinking, we can do it. We can do it. We go through it. That's one. The other reason, I think, is being a scientist. I think I knew the advances. I think I told myself that no, if this treatment doesn't work, don't worry. We're going to have another treatment. So as a scientist, I kept telling myself that everything's going to be okay. And I kind of, I rode the waves of nausea, waves of, 3 days after chemo, I would be very sick. So I would say, you know what, be at home, be sick, but then you're going to get up and you're going to, you're going to go. We actually, you've met her, my Sammy O'Reilly was the first intern that came to Dana-Farber, and there's a wonderful story because after my doctor called, my husband said, I'm going to come pick you up, and we go home and we figure out what we're going to do. And then like literally 2 minutes later, the security guard called and said, oh, your next appointment, he's here. And the appointment was Sammy. So Sammy comes and we talk about, I couldn't cancel it because poor thing, she was there. So I sit there and I said, Sammy, we had, I had promised her for her to be the intern. And I said, Sammy, we have to find you another mentor for this summer. She was 19 at the time. And she's like, no, I've looked at everything you're doing, and I kept saying no. She kept saying, yes, I want to work with you. And finally, I blurted out. I said, Sammy, just half an hour ago, I was told that I have cancer and I don't know what's going to happen. There are a lot of unknowns. And as a mentor, I can't have you, not learn, for the summer. And she's like, no, Dr. Madani, I'm going to come to your chemo rooms. Whatever you need, I'll do it. This young girl showed so much seasoning. Every time I told her no, she says, no, I want to work with you. So Sammy came to my chemo rooms. We talked about how we can develop the She Center. I actually wanted her to meet Tony Fauci, my mentor in DC. So we went on a trip to DC. We wanted, like, one of my ideas was to go present the She Center to Middle Eastern embassies, like Jordanian embassies to the US, to tell them what we are doing so they can bring expats to help us with funding and everything. So Sammy came. We went to Embassy of Oman and Embassy of Morocco. We talked to a trustee of Dana-Farber, and we told her what we do. So we had a busy, in between chemos in that summer, we had a busy time. And I think because of, all this work, I was able to take the chemo.
Yes. It kept you going, right?
Kept me going, yes.
It kept you going. Fantastic. And just, let's move forward many years. Tell us about the programs, how they are structured. What do you do when you go to one of those countries, like when you come to the King Hussein Cancer Center? Yeah. What are you teaching exactly? What are the pillars of She?
Yeah, so we have 3 pillars with She. One pillar is empowering the female physicians and scientists and physician scientists in, bringing in, making health capacity building better. The second pillar is we want to increase two-way dialogue and exchange of information between the West and the East. I made sure to say that we are not there to come and just teach and leave. We are there to teach and make you own what we are teaching. And also, I feel like our physicians and scientists can learn a lot from Middle Eastern physician scientists who are doing work in research limited settings. So it has to be exchange of ideas. It shouldn't be one way. That's our second pillar. And the third pillar, which encompasses everything, is health, science, education, capacity building around all sorts of disease areas. But because cancer is increasing exponentially in our region, because of environmental factors, because of a use of chemical weapons in our region that other regions haven't had, we want to bring in a cohort of oncologists, train a cohort of oncologists within the region. So that's our three pillars. What we do day to day, and our I told you that before the She Center was established, I noticed the gap, and the gap was lack of data. So our kind of bestseller, the best program that we have that everybody loves is scientific manuscript writing. For example, I give you an example of King Hussein Cancer Center. We advertise our workshop. We say we're going to come in 4 months. Like in April, we say we're coming in November. In April, they advertise it. They say, Dr. Navid is coming, put together all of your manuscripts. And then we get between 25 to 30 manuscripts. And we have a wonderful scientific editor who has written books and who is just amazing. I'll send everything to her. She's our employee. She's paid by the She Center. I send all the manuscript to her. She takes a month to 2 months for 30 manuscripts. So she gives a lot of time to it. She corrects the manuscript. She gives them feedback. Then her and I go through the feedback. And then I go to King Hussein Cancer Center, and we have a 3-day workshop. I give them didactic instructions of how to write the manuscript. One of the things we don't do in the Middle East in general is peer review or peer criticism, because we take things personally sometimes.
Yes, that's very much the case. Yes.
So we try to, get the culture of constructive criticism. For example, I give I take your abstract, and then I give you my abstract, and based on the instruction, we edit it. We say, oh, you should write this, or you should take this out. And then we talk, And then on the third day, I give them back the manuscript. They go through it, and they ask me questions. Because English is my second language, and I had to really work hard to write papers, to write manuscripts, I think there is a little bit of the students trust me when I talk to them that I had these challenges too. Writing is hard no matter what, and anybody that I usually hire to come on board to teach, I make sure that English was their second language, because that way they can connect with the students. The other example is career building. So we teach on professional communication, how to write to, collaborators, how to write your CV, how to write a cover letter. For example, I tell them, I say, I get emails from people in the region, and on the bottom it says sent from iPhone. So immediate thought is that this person didn't sit down at the desk with her or his computer and really put a thought behind the email that person is sending. So we give them examples like this to to be more professional, and because we have to do that to be able to play, like you and I were talking, to play in the international field.
Yeah. And if I want to just, pinpoint the main things that you said to our audience, is that, like you said, it's not just the English language. Of course, that plays a part, but also, many scientists and researchers in our part of the world and in many low and middle income countries, they may have the data on their particular field, let's say, maybe not as a country level, but in their field, and they may have the right analytics and so on and so forth, but somehow they struggle to publish because of, like you said, the language and also the accessibility. We know very well in the publishing world, there's a big discrepancy between high income countries and low income countries. It's a difficult barrier to access as well. Also for women, you're a woman of science, the challenges, even globally it's a challenge. And it is talked about that women are less they are underrepresented in the world of publishing, and they're most often than not, they are not chosen as the first author, and so on and so forth, let alone if you come from a Middle Eastern country or from a low middle income country. So I think that what you are doing is fantastic. And I know you once told me of a young researcher from Palestine who had excellent data but struggled to publish because of language and resource barriers. But you told me she worked closely with your team, revised her paper, and she eventually published in a very respected journal. And today she mentors others in her community. And I remember you telling me that ripple effect, empowering one person to lift many, is exactly what she is about.
Yeah.
And I like the fact that, you don't just give lectures, you create long-term relationships. And from what you were telling me, I think this is where the uniqueness of what she offers. It's not a fly-by visit. You do a very academic capacity building lectures. You create those long-term relationships. My goodness, every time you come to Jordan, you're so busy. You have so many friends, so many people, and so on. And so mentorship to you, I think, is personal, right? I think I saw a quote about you saying that mentorship is about one saying, I see you, I believe in you, and I will stand with you. And that's so wonderful that, number one, you give credit to the mentors that lifted you up, and you are doing the same for others. And I think the whole issue of mentorship is very much missing in our part of the world. Of course, there are people who take mentorship lightly, but there are those who really take it seriously, very much like what you do. And when one does that, it's magic. It's magical. And I wish, more of that is being done globally, especially in global health. But I want to go back to your personal journey. We spoke a bit about it, and it was, but we didn't go in depth when at that moment. Yes, you said you were wondering whether you would go back to the continue with the She Center or not. And thankfully you did, because of all the wonderful work that you achieved. But if we can go back, you being, as you said yourself, you said, I went from being the experimenter at Dana-Farber to becoming the experiment as a clinical trial patient. How did that dual perspective shape the way you see science and medicine?
Yeah. Oh, I get emotional when I talk about this. It's amazing. I always say that being a scientist is being a truth seeker. You go after truth. You go after data, evidence. And the first time that I thought about that I am the experiment now was so for the CD4 mimetic that you and I talked about, I had drawn a schematic that with a monkey on top, and it was like a ruler, and then it was day 1, day 3, day 5, what we did each, and then we got blood from the monkeys to check systemic absorption. And I actually show that in some of my talks when I talk about going from experiment to being an experimenter to being an experiment. And then when I became a sample, a number in the clinical trials, I asked my clinical trials doc, I said, can I look at the data? I want to see what's happening. And I had to sign some papers and everything. And he said, okay. But he said, of course, you're not going to see names of people and everything. I said, yeah, that's fine. I knew that I was patient number 2. So that I knew. So when I was reviewing the data, every time I would come to a graph that said patient number 2, I would kind of like smile because that was me. And then I would look at how I am responding to the drug. So this thought of that here I am being an experiment, was quite astounding to me, And also the privilege of being able to look at the data and to decipher the data and talk to my doctor was also an amazing task. But in the same breath, I realized that, that we don't have data, again, going back to what I was talking about, on people that look like us. I asked my doc, I said, how many people of our Middle Eastern descent in these clinical trials, in that one clinical trial? And he said, only you. And then I started doing research for our She Center work. And I found out that 95% plus of clinical trials subjects of our Northern European population. But the Northern European population is a small fraction of the world. So I've become an advocate of trying to have clinical trials in our region with our samples, with our subjects, so that we can start getting data on how these new drugs are going to affect us, The science of the clinical trial was amazing. Unfortunately, on paper, it didn't work for me. However, I think part of the reason that I'm here right now speaking with you is because of that clinical trial. I think it didn't cure me of the tumors. However, it enhanced my immune system to fight the tumors. And then the clinical trial was from January of 2022 to July of 2022. And then they stopped it because the tumors started growing. And then I went on weekly chemo treatment that really helped until a few months ago. And I'm back on, they did another small, it wasn't a clinical trial because the drug is out in the market. But I had never used it. Unfortunately, that didn't work. So last week they put me on another chemo treatment that I'm excited about, and I'll see how it's working.
Well, I think you brought up a very important issue, the fact that in our part of the world, certainly in the Middle East, and certainly in other low middle income countries like Africa and so on, our patients were not given the chance to access clinical trials that, like you said, could either save a patient's life or extend the patient's life. And that is why I became the honorary president of EORTC, which is a European NGO. It's called European Organization for Research and Treatment for Cancer. And together, actually, with the King Hussein Cancer Center and other hospitals in the region, in Oman, in Abu Dhabi, in Qatar, and so on, we're trying, they've given access to enter their trials, which is, a big win. And
Great way.
it's happening right now. But also we look forward and we're working very hard on it to be able to actually initiate our own clinical trials that are, needed for our population and so on. So I think the audience needs to know that, we need to give access to clinical trials and to start building the infrastructure for research all over the world, in Africa, in other low middle income countries, not wait another 20 years before they can start to be able to do any of it. So that's very important. And did you feel, I know you've spoken about your gratefulness about Dana-Farber. It's your home, this is where you worked, and you felt extremely taken care of as a patient. I just wanted to say I have the same feeling for Dana-Farber and Children's Hospital, obviously, because they work together. Because our son Rakan was treated at Dana-Farber from 1998 till 2000. And, I only good things to say about the treatment that Rakan got over there. But on another level, how did you navigate your cancer journey with your two wonderful sons, Zagrov, who's now 17 years old, and Kehan, who's now 15? How did you manage that?
So one of the things that has happened to me, I've lived in this country for not almost, 40 years. This year is 40 years. I have kept my Middle Eastern culture intact, but I have to say professionally, I have become westernized in certain things that the Americans do that I like, I've taken the good, the bad, the ugly. I've released the bad and the ugly, and I've tried to keep the good. And one of the good things about this culture is the culture of transparency. I love that. We hear the word Saratan in our region, and it's an incredibly negative word.
Yes.
It's people sometimes don't tell their family that they have Saratan.
Yes.
People, if you have it and you're elderly, the doctors and the family don't tell you, that you have it. And I understand the reasoning behind it. I understand it, but I don't follow it because of the transparency. So I think, like I said, May 9th, I was diagnosed, and I had to get a big surgery May 24th, I think. So I had to go to the hospital, and except for having my, giving birth to my children, I'd never been to a hospital before. I was my doctors used to say that I was a model of health, So I knew they're going to have questions. I didn't want them to worry, And let's see, this was 6 years ago. So Zagros was 11 and Kehan was 9. And we went out to a restaurant, and my mom was there. My mom was actually visiting. So we told all three of them. We said, I have cancer, but cancer is curable these days. We need help. They asked questions. Zagros asked a lot of questions, how I'm going to be. Kehan only asked one question, and it breaks my heart. He said, are you going to lose your hair? Um, I had always had long hair, and I didn't do much with it. It was easy to maintain. And when he was a baby, until 6, 7 years old, he would hold my hair and go like this when he was hugging me. And he said, "Are you going?" And I said, "I will try not to lose it, but probably yes, baby, I will lose my hair." And I actually tried, I think 5% for vanity and 95% for Kehan. I used the cold cap. Have you heard
Yes.
of the
Yes,
Yeah.
yes. Do they
Yes.
work? I mean,
It did not work for me. And I have to say, I mean, this is 6.5 years ago. I'm hoping the technology has become better. Princess Dina, it was so painful that and I had to have it for the whole day when they were treating me with chemo. After 5 minutes, I just wanted to take my head and throw it out the window. It gave the worst headache. So I did it. I really did it for him. Unfortunately, it didn't work out. I did end up losing my hair. It thinned out. But now, as you've seen me, I try to have fun with the hair. Here's me for, 50 years. I never did anything to my hair. My hair was long. Maybe I highlight it. That's it. And then now I do blonde.
it looks so stylish. That's the thing. It's fantastic that you're experimenting. I mean, I know with my long hair, I'm always worried to do something
Yeah,
extreme, right?
me, me too.
Yes.
And I had not. And the daughter of a close friend of ours, a couple of days ago, I saw her, and she said, "Auntie Navid, I really want you to do pink. Can you?"
I think it would suit you. Give it a go. And what about your husband Kirk in all of this?
Yes. So Kirk is a scientist like myself. He works on pediatric brain tumors, GBM especially. And he's a wonderful nerd scientist. And I think for him, he kind of dives into treatments to keep himself grounded for what I'm going through. He looks up treatment, he looks up different doctors in case we have to get second opinions. I have complete confidence with my team at Dana-Farber, but he's constantly looking. He's constantly, he goes to a lot of cancer conferences, so he talks, and he actually, in addition to pediatric cancers, he has, learned a lot about ovarian cancer as well because of me. So I think that's how he deals with the situation.
Oh, yeah, it really takes a family, doesn't it?
Yeah,
And there's so many dynamics always. But
yeah.
one always feels, I certainly from my experience as a carer of a child who had cancer,
Yeah.
it's always, one felt always better to be feeling you are doing something, right?
Right,
Not totally helpless. It
right.
was a therapeutic at that time. Even
Yeah,
me cleaning the hospital room of our son, even though it was cleaned by the staff. But no, I, as a Middle Eastern person, I came armed with my bottle of Dettol, which of course later on we know it's not exactly friendly or organic, right? But we were the only room that stank of Dettol. I had to clean everything myself. But I felt good about it. I felt, you know what, I am attacking these extra germs that are lurking there to derail the treatment of our son. So,
Yeah. Did you
um,
have family with you when you were here?
yes, that's the good thing about our Middle Eastern heritage. The minute our son was diagnosed
Mhm.
and the word, was out, the
Mhm.
whole family made a plan that
Mhm.
one by one they would
Mhm.
come. My sister would come for 2 weeks, then my brother would come, then Merad's parents would come. So
Mhm.
we were truly never left alone.
That's great.
And I think that was such an important part of the treatment, to be honest, especially that we had our daughter Shirin, who was only four
Oh,
years
he
old, 4 years
little.
old.
Yeah.
So alhamdulillah, as we say, we were
Mhm.
truly supported. I want to now talk about your advocacy about the dire cancer situation in Palestine, especially, in conflict zones, and you have published multiple articles on the barriers and challenges to cancer care, especially in Gaza and the West Bank. And of course, now in Gaza, there is no cancer care, as you know. Um, and you advocated for that when so many in the global health community kept silent about Gaza and the genocide.
Mhm.
I wrote a statement with Professor Richard Sullivan early on in the genocide, calling and asking for these organizations to speak
Mhm.
up for humanity, speak up against the to speak up unequivocally against the killing and murder of health professionals, the destruction of hospitals, the bombing of ambulances, etc.
Mhm.
We were not asking them to weigh in politically on anything. But if
Mhm.
somebody is going to talk about the sanctity of health, whether in
Mhm.
conflict zone or in other times, that would have been the global health community. And I'm still waiting, even today, for some brave statements coming from those global health community, huge organizations. I hope they will say something, because one day they're going to regret that
Yeah.
they were not on the side of humanity.
Yeah.
Inshallah, as we say,
Inshallah.
this happens.
Yeah.
But you advocated, and I want to thank you for that, because you got us. You planned through the She Center. You got us a sold out meeting at the Union for International Cancer Control, UICC Cancer Congress in Geneva. There weren't enough seats. Do you remember that, Dr. Navid? People really wanted to come and hear. What
Yeah.
compelled you to take on this advocacy? And how does conflict and
Yeah.
instability amplify health inequity, especially in cancer care?
Yeah. Um, I think it's data. I think for me it was data, looking at the data coming out of the region before the genocide and now after the genocide. I don't know. I don't have any um, um, reasoning for why the global health and the medical community hasn't, you know, um, come out and has talked about the genocide. I'm very disappointed, I have to say. But at the same time, for me, two reasons. One, I'm going through cancer. And if my hospital was getting bombed, if I wasn't getting my treatment, I wouldn't survive. You know, so I can relate to what they're going through. That's one. Because of it, I've become a spokesperson for it. That's one. The other reason is data. Like I said, is evidence based. Everything we've done, everything we have published has been backing up the data. You know, we just had a wonderful paper in eClinical, which is a part of Lancet, about barriers to pediatric care, and all the data is before the genocide, and it's terrible. What's happening to these pediatric cases. Um, it it is not humanly possible for people to see what's happening in Gaza before the genocide and allowed it to happen. So my mission is, with evidence-based collection of data, we keep publishing and bringing into the limelight. My postdoc, who Dr. Romavi, she gave a wonderful talk on Friday. We had a global health summit at MIT and Dana-Farber Friday, Saturday, Sunday. I talked yesterday. She talked about the paper, and people came, congratulated her. They congratulated me. Everybody pretty much that came were Westerner, and when they talk to me about these things, I say, listen, 5 years ago, I didn't know. I didn't know what was happening in occupied Palestinian territories. But now I know. And for me, as a human being, as somebody with morals, as a scientist, as a data-driven person, it is my job to be able to bring this to attention of international community. So everything we're doing, like I said, is data-driven. We want to publish more. We wanted to publish about breast cancer. We want to publish about, we are working on a paper that talks about lack of radiation therapy in Gaza before the genocide. Like, Israeli government didn't allow radiation therapy in Gaza because of the potential dual treatment. So we brought in physicists to talk and say that no, radiation therapy doesn't allow you to make a nuclear bomb, So, my mission is to bring this injustice, this inhumanity, especially around pediatric cancers. Because as you know, and you've been such an amazing voice for PCRF and for pediatric cancer, pediatric cancers in Western world, 80% and above is curable. The kids don't even remember, but most of the world doesn't live in high-income countries. 80% of the world are in low and middle-income countries, and majority of the kids are living there. And that's something that it was brought up to light yesterday at the summit, that we need to bring in our tools to be able to solve this. And scientifically, we have the tools. Technologically, we have the tools. We just need resources. We need collaborations and resources.
Yeah. And, that's the thing. Resources, for some reason, billions of dollars are suddenly available when you want to obliterate Gaza, for example, and commit genocide. And yet when you need it for health or for education, for some reason it disappears. Poof, it's not there. And I think all of us, people with humanity all over the world, we should really advocate that enough is enough. We need the resources that are there, and they need to be put to use to fight cancer and other diseases. And I just read an article the other day about how, for example, HIV, the work that you've been working on, and you've been working so hard to control the disease, the fact that it could now even go back to increasing. Simply because, especially in those regions that are heavily reliant on USAID money and PEPFAR, for example. And there was even model that was worked upon suggested that if donor funding, including USAID and PEPFAR, continues to decline, there could be 10.8 million extra HIV infections and 2.9 additional deaths by 2030. I mean, that's crazy. And I've read another article, and I've even posted it on my social media, whereby even cuts, happening for pediatric cancer. I mean, come on. I mean, what are we doing? Instead of increasing the money for research for cancer in general and other diseases, it's being cut. So I think, I thank you for doing the work on Gaza and for giving data, because I think, we get to be emotional here. I look outside my balcony. You've seen my balcony. I look at Palestine with a heavy heart, so I'm emotional. And we've known the facts for 50 years of the occupation and its effects. But like you said, not many people knew, because there was a huge blackout on any news coming from our side. Until, of course, after this big, huge cost, and thanks to human cost, what I'm saying, people suffering in Gaza, for the truth to finally come out. And big thanks to social media for that. And TikTok. I hope they don't stop TikTok, because, everywhere else we've been shadow banned on our social media, even for speaking our narrative and our truth. But anyhow, thank God there are people like you, Dr. Navid, and I know there are many people all over the world, including Western countries. It's the people who are standing up. Perhaps not their governments, but the people are out there on the streets week after week. And I think this gives hope for humanity.
Yeah, absolutely.
I want to talk about your tea time with She again. And I have my tea. I'm going to have a little sip.
Yes.
Through your tea time with She, you've created a space for dialogue across science, culture, and society. And you've had diverse guests, including the wonderful Noam Chomsky, Tony Fauci, as you said, the Fauci of the coronavirus. I mean, that's how we know him, right? What has surprised or inspired you most in these conversations?
Before we start that, I'm going to take my beautiful coffee out, because somehow I'm getting hot flashes.
Okay. Okay. You're allowed. You're allowed.
Yeah. One of the drugs that I'm on, they say that it gives you like hot flashes and all that. So all of a sudden I got really warm. So I can't, part of being a mentor is to be an example for others. And I really try to do that. I cannot take the credit for tea time with She. I have a very good friend of the She Center, and he's a Italian Spanish. At the time, he was Italian Spanish postdoc, Dr. Alberto, and when COVID happened, I was like, oh, what am I going to do? We can't do travel and everything. And he said, Navid, you're a very good storyteller. Why don't you do a webinar? I'm Princess Dina. I'm so old-fashioned. Like, I didn't have social media until 5 years ago. I did only because of 6 years ago, because of the She Center and everything. I didn't have Facebook. I didn't have anything. I still don't have Twitter or TikTok. So I'm like, webinar. What do you think? He said, no, you have a lot of people in the field that know you. You can bring in, you can talk. And he really persuaded me. And we came up with tea time, because in Middle East, we love our tea. And also in Middle East, tea time is when women get together and they talk. They talk about reproductive health. They talk about their life. So the name came from that. And then we started, and I actually wrote to Tony. This is now like July of 2020, after the lockdown and everything. And Tony was just very busy, obviously. And he said, Navid, I can't do it. And at one point, he had throat surgery. So we couldn't have him at the time. It took us 4 or 5 years before we were able to get him. But then I started making a note of, all the people that I've known throughout, the HIV field. One of our first webinars was with a wonderful, also a mentor, wonderful infectious disease doc in Iran, who Dr. Mohraz. I call her the lioness of anti-infectious diseases, like, the mother of response to infectious diseases in Iran. She is amazing. She is a wonderful voice. So she was on. A colleague of mine, Dr. Kate Hankins from Canada, who is, I call her Tony of Canada. She was on. Dr. Gina Brown, who was at GSK Pharmaceutical Voice for COVID. And it became, and also, who else was on, and her, is Dr. Rana Dajani.
Oh, wow.
Who's been a friend of mine. And we talked about women and women's response to COVID. So we had, molecular biologists like Rana, Gina, who's an MD from pharmaceutical company, and Kate and Dr. Mohraz. And then we've had Maz Jobrani, who is the Iranian comedian, and he is fabulous. His sister died of breast cancer. So we talk about breast cancer, the effect on his life and his family, and also the effect of laughter as a medicine. We've had nutritionists, like you said. We've had Noam Chomsky talking about the region and how young people can really help our region, be better. Middle East and North Africa, that is. We've had surgeons, we've had lawyers. We've had an immigration lawyer telling our people how we can navigate. Of course, this was before this administration, which is, now there's no communication with the Muslim world. It's been a wonderful platform. Next week, shout out to everyone. Please sign up. Next week, we have a fabulous guest, Princess Dina Mired, about being a voice for the voiceless.
Yes.
We've had Dr. Zainab.
Yes.
During International Women's Week, we had Dr. Zainab this year.
Yeah. But I wanted, to delve deeper. So in a way, I see, I've started my podcast simply because I said, you know what? I don't want to be the interviewee anymore. I mean, I don't mind doing it once in a while, but I said, you know what? I've always wanted certain questions to be asked, to be directed at me for me to answer, and they never came. So I said, you know what? I don't want to be chosen. I want to choose. I want to be the interviewer. Yeah. And I think what's wonderful, and I'm sure you would agree with me, with your Tea Time with She podcast and my podcast, is the fact you can really delve deeper into the human, the whole human, right? Yeah. I mean, you're a scientist. You've achieved a lot in that world, in that career, and so on. But the audience gets to know you. And it's nice to know, you've come from Iran, the journey that you've had, your own narrative on things, your own perspectives. It's interesting and it's very enriching. And I love the fact that on your podcast, you're mixing everybody, a comedian, somebody nutritionist, somebody scientist. We're all humans first, right? So, I love that about your podcast, and I hope the same people feel with my podcast. I really try to give a
They do.
chance for people to know the human
The
behind
human.
the successes.
Yeah. Yeah.
Closing reflections. If you could speak directly to a young woman in the Middle East who dreams of being a scientist, what would you tell her?
Yeah. Don't give up. Don't ever give up. Dream of anything. If you want to be a scientist, if you want to be a global health advocate, if you want to be a oncologist, do not give up. I look at myself 30 years ago, and I think to myself that I didn't have, I never said, oh, I'm doing this to become a faculty member at Harvard. I'm doing this I never said that. I just wanted to have a good base. And I say that to all my students. Good base, you have good base, you have good training, good things will follow after that. And show your humanity, like you said, these webinars bring out the humanity in all of us. And that's what we need. We need human physicians. We need data-driven physicians for our region. Yeah, go for it. Never give up. Never give up your dream.
And you having walked this extraordinary path of science, illness, resilience, and advocacy. So you have big hopes, right, to leave behind for the next generation of scientists. What is your legacy for that?
I think mentorship. It's a ripple effect. It's a butterfly effect. To me, starting the She Center was small at the beginning, and it's, a butterfly, about the butterfly effect. You do a small thing and then you get the ramification of it somewhere around the world, that's what we did. I mean, what we do in Jordan. I mean, I want to, have a shout out to my 3 students, Sarah, Albana, Majali, and Gashar. These 3 are taking on my vision for students in Jordan, it's, inshallah, I hope my legacy is mentorship and the ripple effect of mentorship.
I am sure your legacy not only will be that, it will be much more, Dr. Navid. You've really touched our hearts and minds and soul. You're a wonderful friend. I look forward to your visit in November, as always. And I promise to take you to all these wonderful places that sell kaftans. I promised you that. So we will do the rounds together.
Inshallah.
I hope that my audience enjoyed getting to know you the same way that I know you. And thank you so much for coming on my podcast. It's a real honor and a privilege. Thank you very much.
Thank you so much. It's a privilege for me.
Thank you.